When men reach the age of 50 and beyond, the prostate becomes a point of concern. This small gland, about the size of a walnut, plays an essential role in reproductive health by producing seminal fluid. But as we age, the prostate naturally undergoes changes, sometimes becoming enlarged, sometimes inflamed, and in rare cases, even cancerous. That's why questions about daily habits, including masturbation, come up frequently. What does it really do to the prostate if you engage in it daily after 50? Let's break it down clearly and without the myths. First, we need to understand that ejaculation, whether through sex or masturbation, has a physiological purpose. It helps clear out seminal fluid, reduce congestion in the prostate, and keep things moving. Several studies suggest that regular ejaculation may lower the risk of prostate cancer by flushing out potential irritants or harmful substances. In fact, men who ejaculate more frequently, even into their 50s and beyond, often report better prostate health outcomes compared to those who rarely do. Now, does masturbating daily after 50 harm the prostate? The answer is not really, at least not for most men. In fact, it can be beneficial. Ejaculation helps reduce the buildup of prostatic fluid, which can otherwise cause discomfort or even increase the risk of inflammation. For many, it can ease symptoms of prostate congestion, making urination smoother and reducing pressure. It also supports better circulation in the pelvic area, which is important as blood flow tends to decline with age. But let's also talk about balance. While daily masturbation is generally safe, overdoing it to the point of exhaustion or pain can have side effects. Too much friction may cause irritation, and in men with an already enlarged prostate, frequent arousal without complete release might actually worsen pelvic discomfort. The key is listening to your body. If you feel sore, fatigued, or notice urinary changes, it may be a sign to scale back. Another point is hormones. After 50, testosterone levels gradually decline, and daily masturbation doesn't deplete your testosterone the way some myths suggest. In fact, moderate, regular ejaculation can help maintain healthy hormonal balance by reducing stress hormones like cortisol and promoting better sleep. Stress relief, improved mood, and even cardiovascular benefits are added bonuses, which indirectly support prostate health too. That said, it's important to keep lifestyle in mind. Masturbation alone won't protect your prostate if your diet is poor, you're sedentary, or you ignore regular screenings. Eating more plant-based foods, staying active, maintaining a healthy weight, and getting routine check-ups all play critical roles. Prostate health isn't just about what you do in the bedroom, it's about how you live day to day. So what happens to your prostate if you masturbate daily after 50? In most cases, it keeps the gland active, clears out fluids, lowers cancer risk, reduces inflammation, and supports urinary function. It's not a problem unless it becomes obsessive, painful, or starts interfering with your quality of life. The bottom line, daily masturbation after 50 is not harmful. In fact, it's often beneficial, so long as it's paired with overall healthy habits and regular medical care. When men cross the age of 50, the prostate gland often becomes a central focus of their health. This small gland, though easy to overlook when younger, plays a critical role in both reproductive and urinary function. It produces seminal fluid, supports sperm health, and lies just beneath the bladder, surrounding the urethra, the very tube that allows urine to leave the body. Because of this position, any changes in the prostate directly affect urination and overall comfort. One of the most effective yet often overlooked ways to keep the prostate healthy is through regular ejaculation. Let's start with the concept of prostate congestion. Imagine any gland in the body that produces fluids, whether it's the salivary glands, sweat glands, or oil glands in the skin. If those fluids aren't released regularly, they tend to build up, and sometimes that stagnation can lead to inflammation or discomfort. The prostate is no different. It produces seminal fluid, and when a man goes for long stretches without ejaculating, this fluid can accumulate, creating a sense of fullness, irritation, or pressure. Many men describe this as pelvic heaviness, itching, or even difficulty starting urination. Regular ejaculation, whether through partnered sex or masturbation, helps clear out this buildup and allows the gland to function smoothly. It's like flushing the pipes. It keeps the system clean and moving. Beyond comfort, there's also compelling evidence that ejaculation frequency is tied to prostate cancer risk. Several large-scale studies, including one from Harvard University, have shown that men who ejaculate 21 or more times per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated less frequently. The reason isn't fully understood, but researchers believe it's related to the way ejaculation clears out potentially harmful substances, such as carcinogens, from the prostate. Seminal fluid can carry byproducts of cell metabolism, and expelling it regularly may prevent these from lingering in the gland where they could cause damage. In this sense, Ejaculation acts as a natural detox mechanism for the prostate. For men over 50, this is particularly important because prostate cancer risk increases with age. While genetics, lifestyle, and environment all play a role, maintaining healthy sexual activity could be a simple and natural way to lower risk. It's worth emphasizing that it doesn't need to involve a partner. Masturbation has the same protective effect. What matters is the release and the clearing of prostatic fluid. Now let's talk about urinary function, which becomes a growing concern as men age, because the prostate surrounds the urethra. Any enlargement or inflammation directly impacts the ease of urination. Symptoms like frequent urination, waking up at night to pee, or difficulty emptying the bladder often trace back to prostate issues. Regular ejaculation can help reduce some of this burden. By keeping the gland less congested, it minimizes swelling and allows the urethra to remain more open. Men who ejaculate more often report smoother urine flow, less urgency, and reduced discomfort when compared with those who remain abstinent for long periods. There's also an indirect benefit worth noting. Ejaculation improves circulation in the pelvic region. As men age, blood flow can decline, leading to weaker muscles, reduced erectile function, and slower healing. Ejaculation promotes blood flow to the prostate and surrounding tissues, helping them remain nourished and oxygenated. This improved circulation supports both reproductive and urinary systems, reinforcing their long-term health. It's natural to wonder whether daily ejaculation after 50 might be too much. The reality is that for most men, it's not harmful. In fact, for many, it's beneficial. The body is designed to handle it. Of course, the key is balance. If it causes soreness, fatigue, or interferes with daily activities, that's a signal to slow down. But if it feels natural, provides relief, and improves comfort, then daily ejaculation can be a powerful tool for maintaining prostate health. It's also important to dispel a common myth that frequent ejaculation drains testosterone or weakens masculinity. Science has shown the opposite. Ejaculation doesn't lower testosterone levels long-term, and in some cases it may even boost sexual confidence and overall well-being by reducing stress hormones like cortisol. When stress goes down, blood pressure improves, sleep quality rises, and all of these benefits positively impact the prostate as well. In conclusion, the relationship between ejaculation and prostate health is not just about pleasure, it's about function, protection, and longevity. For men over 50, regular ejaculation helps reduce prostate congestion, lowering discomfort and inflammation. It provides a protective effect against prostate cancer by flushing out harmful substances, and it supports urinary health by keeping the gland less swollen and improving circulation. Simply put, regular ejaculation is a natural, accessible, and effective way to care for one of the body's most important glands. When discussing prostate and sexual health after 50, the topic of daily masturbation often sparks curiosity and sometimes even concern. Many men wonder, is it safe to do this every day at my age? Will it help me or hurt me? The reality is that daily masturbation is generally safe and, in many cases, beneficial. But like anything in life, balance matters. Too much of even a good thing can tip the scale in the wrong direction, leading to irritation, fatigue, or discomfort in the pelvic region. Let's explore why daily masturbation can support health and where men should be mindful. To begin, let's focus on the benefits. Masturbation is a natural way to achieve ejaculation, and as mentioned earlier, ejaculation helps clear out prostatic fluid, reduces congestion, and promotes better prostate health. After 50, when the risk of prostate enlargement and inflammation increases, this clearing function becomes even more valuable. Daily ejaculation can prevent the buildup of seminal fluid and reduce the pressure that makes urination difficult. In this sense, daily masturbation is not just harmless, it's therapeutic. But the benefits extend beyond the prostate. Daily masturbation supports mental and emotional health as well. It's a powerful stress reliever, lowering cortisol levels and releasing feel-good hormones like dopamine and oxytocin. These hormonal shifts can improve mood, promote better sleep, and reduce anxiety. For many men over 50, stress is a silent factor affecting both cardiovascular health and sexual performance. A simple, natural act like masturbation can counteract those effects. It also improves circulation in the pelvic area. Regular blood flow ensures the prostate and surrounding tissues stay nourished and healthy. This circulation can help preserve erectile function, which naturally declines with age due to reduced blood supply. By maintaining an active sexual routine, men keep those pathways engaged, reducing the likelihood of stagnation or dysfunction. Now, with all of these benefits, it's natural to ask, why even worry about balance? The answer is that while daily masturbation is safe for most, it can become problematic if practiced excessively or without mindfulness. The first issue is physical irritation. Skin is delicate, And repeated friction, especially without adequate lubrication, can cause soreness, redness, or even micro tears. This isn't dangerous but can be uncomfortable, and over time, it may discourage intimacy or cause unnecessary worry. Simple adjustments such as using lubrication or varying technique can prevent these issues. The second concern is pelvic discomfort. For men with an already enlarged prostate or chronic pelvic pain, excessive arousal without enough recovery time may worsen symptoms. Some men report aching in the pelvic floor or a sense of heaviness after frequent ejaculation. This doesn't mean daily masturbation is harmful, but it does mean listening to your body is essential. If discomfort arises, spacing sessions out every other day or a few times a week might be more sustainable. Another factor is energy balance. At 50 and beyond, the body's recovery is slower than in youth. While masturbation itself doesn't drain testosterone or vital energy, doing it compulsively can leave men feeling fatigued, especially if paired with late nights or lack of sleep. The key here is not the act itself, but how it fits into the broader lifestyle. When balanced with exercise, good nutrition, and rest, daily masturbation remains safe. When done at the expense of those habits, it may contribute to fatigue. It's also worth addressing the psychological side. For some, daily masturbation may shift from being a healthy habit to a coping mechanism for stress, loneliness, or boredom. In that case, the act itself isn't harmful, but the dependence on it may signal that deeper emotional needs aren't being met. For men in their 50s and beyond, maintaining social connection, purpose, and intimacy with a partner, if available, are just as important for health as physical release. Masturbation should complement, not replace, those areas of life. Ultimately, the principle is moderation and awareness. Daily masturbation is safe and often beneficial, but if it ever causes irritation, pain, or interferes with energy and well-being, that's the body's signal to adjust frequency. For some men, daily release feels natural and restorative. For others, every 2 to 3 days is ideal. There's no universal rule. The best frequency is the one that supports comfort, health, and overall vitality. In conclusion, daily masturbation after 50 is not something to fear. It supports prostate health, reduces stress, enhances circulation, and contributes to better sleep and mood. The only caution lies in balance, paying attention to the body, preventing irritation, and ensuring that it complements rather than dominates one's lifestyle. When practiced mindfully, it's a safe and valuable tool for maintaining both sexual and overall health well into the later years of life. When men reach their 50s and beyond, sexual health and prostate health become topics of increasing concern. While daily ejaculation through masturbation or partnered sex can support the prostate, it's only one piece of the puzzle. The truth is that long-term prostate health depends just as much, if not more, on broader lifestyle habits. Diet, exercise, and routine medical screenings play a decisive role in whether the prostate remains healthy or becomes vulnerable to enlargement, inflammation, or even cancer. Let's break down why these habits matter and how they can be integrated into daily life.
First, let's focus on diet. The prostate, like every organ in the body, is influenced by what you eat. Research consistently shows that diets high in red meat, processed foods, and excessive dairy may increase the risk of prostate problems, including cancer. On the other hand, diets rich in fruits, vegetables, whole grains, and healthy fats offer protection. Lycopene, found in tomatoes, is particularly beneficial for prostate health. So are cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts, which contain compounds that reduce inflammation and support hormone balance. Omega-3 fatty acids, found in fish like salmon and sardines, also have anti-inflammatory properties that protect not just the prostate, but overall cardiovascular health. Aging men also need to be mindful of hydration. Drinking adequate water keeps the urinary system functioning properly, reducing irritation in the bladder and easing the workload on the prostate. Caffeine and alcohol, when consumed in excess, can irritate the urinary tract and worsen symptoms like urgency or frequency. Moderation in these areas makes a meaningful difference. Next comes exercise, which is a powerful but often underutilized tool for prostate health. Regular physical activity helps maintain a healthy weight, and that's crucial because obesity is linked to an increased risk of both benign prostatic hyperplasia, BPH, and prostate cancer. Exercise also improves circulation, ensuring that the pelvic region gets sufficient oxygen and nutrients. Activities like brisk walking, swimming, or cycling for 30 minutes a day can significantly reduce urinary symptoms associated with an enlarged prostate. Strength training is equally important. Maintaining muscle mass supports hormonal balance, particularly testosterone, which naturally declines with age. Resistance exercises not only preserve muscle, but also help regulate insulin and reduce systemic inflammation, both of which indirectly affect the prostate. For men already experiencing pelvic discomfort, pelvic floor exercises, sometimes called Kegels, can strengthen the muscles surrounding the bladder and urethra, improving urinary control. Beyond diet and exercise, routine medical screenings are critical. Prostate issues often develop silently with few symptoms in the early stages. By the time urinary changes or discomfort become noticeable, the condition may already be advanced. Regular check-ups with a healthcare provider ensure that any issues are detected early when they are most treatable. This usually includes a digital rectal exam (DRE) and a prostate-specific antigen (PSA) blood test. While the PSA test has its controversies, it remains a useful tool when interpreted in context by a qualified physician. Men with a family history of prostate cancer should be especially vigilant and may need to start screenings earlier. It's also important to recognize that prostate health is influenced by overall lifestyle choices beyond the physical. Chronic stress, for example, raises cortisol, which can contribute to inflammation and hormonal imbalances. Learning to manage stress through mindfulness, meditation, or simply making time for relaxation is just as vital as nutrition and exercise. Sleep quality is another overlooked factor. Poor sleep has been linked to increased risks of both prostate enlargement and cancer. Establishing a consistent bedtime, limiting screen use before bed, and creating a restful sleep environment all contribute to better long-term health. When you look at the big picture, daily masturbation or regular ejaculation supports prostate health, but it cannot offset an unhealthy lifestyle. A man who relies only on sexual release while ignoring diet, remaining sedentary, and skipping medical screenings will still face elevated risks. On the other hand, combining regular ejaculation with a nutrient-rich diet, consistent exercise, stress management, and timely screenings creates a holistic approach that maximizes prostate protection and overall vitality. One of the most empowering messages for men after 50 is that prostate health is not predetermined. While aging is inevitable, the choices you make each day have a profound influence on how your body responds to those changes. Eating a colorful plate of vegetables, staying active, scheduling screenings, and yes, maintaining a healthy sexual routine are all part of the same strategy, keeping your prostate functioning well and your quality of life high. In conclusion, while sexual activity, including daily masturbation, plays a valuable role in maintaining prostate health, it cannot stand alone. Diet, exercise, and screenings are equally, if not more, important for long-term well-being. By integrating all these habits, men can protect their prostate, reduce the risk of cancer and urinary problems, and maintain vitality well into later years. The prostate may be small, but the lifestyle choices that protect it make a big difference.